was already
Good
there
morning
before
everyone. So today I will be discussing my topic on polymers and nanomaterials in dentistry. How we are helping in advancing biomimicry, regeneration purpose, and how it is delivering precise therapeutics. So coming to the evolution of dental materials, we can see in this chart that how the dental materials evolved through the years. So what we can see is in the mid 1800s, dental amalgam came into play and mercury alloy was used for fillings. It was strong and durable and long lasting for posterior restorations. Early 1900s saw zinc oxide, eugenol and vata percha used, or specifically for sedative antibacterial purposes, used in root canals and temporary restorations. In 1930s to 1950s, we saw the acrylic resins, specifically the PMMA, which was used as a denture-based material for aesthetic but prone to shrinkage and instability. In 1990s, resin-modified GIC was there. It combined strength for the resin also, and the fluoride release was used in liners, bases and fillings. In 2000s, CAD-CAM came into play with zirconia, lithium and silicate. It had high strength aesthetics for crowns, bridges, and it required digital milling setup. And in 2010, smart polymers came into play, bioactive glasses for for which were fluoride releasing for demineralization purposes, used in pulp capping for liners, regenerative endodontics. And 2020s to present, we have seen the development of nanocomposites, injectable hydrogens and bioengineered scaffolds for tissue regeneration, antimicrobial properties. Then specifically for dental patches, they can be developed as an implant coatings and for cutting edge research use. So coming to the classification, so it is first comes as polymers. So what are polymers? These are long chains of repeating molecular units, monomers, forming macromolecules. If we see for the natural examples, arch, chitosan and alginate. Synthetic can be TMMA, PEG and PEEK. Smart, they are smart pH temperature responsive. So any changes in the pH and temperature, so the mechanical properties of these materials will change. Next comes nanomaterials. These are materials with at least one dimension in the 1 to 100 nanometer scale, showing unique properties. Examples are metal based for silver, zinc oxide and titanium oxide. Ceramics, nano hydroxyapatite, carbon based and graphene. Polymeric, PLGA, nanoparticles. Nanocomposites, these are hybrid materials combining both polymers with nanoscale fillers to improve function. Examples include chitosan zinc oxide combinations, resin nanofiller composites and hydrogel based systems. So why there is a need for innovation in the dental materials? Because we have to improve for the biocompatibility of it. We have to check for bioactivity and minimal invasiveness procedures for use in dentistry. So I want to quote a line that the future of dentistry lies at the interface of nanotechnology and regenerative polymer science. So the advent of this will help to deliver the personalized medicine to the patients. So coming to the dental polymer structures, properties and types, the structure is long chain macromolecules made of repeating monomer units. As polymers, I told you previously, may be linear, branched or cross-linked. Linear examples are PMMA, cross-linked are BIS-GMA, and block polymers include PET, PLA. Properties are biocompatible, it is moldable in nature, adhesive, and it can be customized for strength purposes, thermoplastic, and or either they can be thermoplastic in nature or thermosetting in nature. The examples are adhesives, flexibility and degradation control can be done, and drug releasing properties can be modified. And they are classified on the basis of origin, function or either responsiveness. As I already told, the examples are natural, chitosan, gelatin, silk fibroid, synthetic PMMA, PEG, PEEK and smart, thermoresponsive or pH responsive. Examples include hydrogel, shape memory, polymers. So coming to the various nanomaterials used in dentistry, the definition, these are hybrid systems integrating polymers with nanomaterial. Examples I already told. It focuses on tunable degradation, bioactivity and mechanical resilience. for providing support for regenerative purposes. Where these are used, applications across various specialties. First, we can say in conservative dentistry and endodontics, they use the nanofillers and resin composites for reduced polymerization shrinkage. Nanohydroxyapatite for dentin demineralization is used, and chitosan-based endodontic sealers with antimicrobial properties are used as a sealer. In prosthodontics, we commonly use PMMA with titanium oxide and silver nanoparticles for antifungal denture bases, and PEEK polymers as metal-free prosthetic alternatives. For oral surgery and implantology, they use the bioactive nano coatings on titanium implants and injectable thermosensitive hydrogens for bone regeneration. In periodontics and preventive dentistry, the nano silver varnishes, fluoride loaded nanogels, and smart dental sealants are used for the use in pediatric dentistry. What are the techniques for the dental characterization techniques for dental nanomaterials? How we are going to characterize if we have developed the nanomaterial based polymer. So the common techniques is use of SEM and TEM. The purpose is to assess the morphology and the particle size of the developed material. FTIR will recognize the functional groups in the polymers. XRD will see the crystallinity and the nanoparticle phase differences. TGA, DSC will see for the thermal behavior, how the depending on temperature, the properties of the developed materials change. Contact angle, specifically whether it is hydrophobic or hydrophilic. Zeta potential for the stability of the nanoparticles, and UV and NIR for optical properties. So coming to the next things, the toxicity, regulatory and biocompatibility considerations when we try to develop a nanomaterial. We do in vitro and in vivo biocompatibility testing, which include MDT and self-proliferation assays. Long-term stability and degradation are crucial factors for this. Nanotoxicity nanotoxicity concerns involve accumulation and immune responses that are developed through the materials that we put forth in the oral cavity. And there are various regulatory frameworks and bodies that are regulating the manufacturing of this, such as ADA and ISO, are important for compliance for biocompatibility issues. Some examples from high impact journals include they have developed injectable keratin tech hydrogels for salivary gland regeneration. Graphene silver nanocomposites for periodontitis have been developed. Zinc oxide chitosan based patches in oral potentially malignant disorders have been developed. And 3D printed polymerase scaffolds with controlled pore morphology has been developed. These are the recent advances in research highlights from 2020 to 2025. When we come to the challenges and limitations, challenges include nanotoxicology and standardization of the developed biomaterial, batch-to-batch variability in polymer synthesis, cost of the nano formulations, and ethical concerns in vivo testing. And what can be the future directions in dental biomaterial research? Innovative horizons include self-healing composites, use of AI-designed polymer nanomaterial hybrids, regenerative biolinks for 4D bioprinting, quantum dot-based diagnostics for periodontitis, and personalized and nanotherapeutics in oral cancer. Coming to the conclusion and the key takeaways, so polymer nanomaterial hybrids are transforming the clinical dentistry. Integration of material science with tissue engineering holds promise for smart, minimally invasive dental solutions. Cross-disciplinary action in research and dentistry with nanotech and regenerative biology is key to the next generation of dental therapies that will be developed through dental materials and nanomaterials. Thank you.
This is for that this